Ella, also, if you want to make Satira co-host as well, if you don't want to let people in from the waiting room while they're waiting.
Yeah. I see a chat. Oh. Okay, hello everyone. I'm just gonna wait for a few more minutes until other people will show up. And then we're gonna start our presentation today. And I hope you'll enjoy it. So let's just get started. I just want to welcome you to today's presentation. And this presentation is actually being hosted by Connect the Space. And my name is Dr. Leela Rajabian, and I actually teach at SUNY Empire State University. And I teach for the Master of Information Technology in Information Technology and Cybersecurity programs down there. So today's topic is about cybersecurity and healthcare. And we're just going to talk about how actually cybersecurity being applied, and also some terminology. We're going to learn about overview of the cybersecurity, some terminologies about cybersecurity, and how it's related to the field of healthcare. I just want everybody to just give me a quick kind of a background of yourself. Maybe just who you are, just for a few minutes. If you just want to, you know, write it, or I think all of you, you can unmute yourself if you want. I think we're just gonna wait for a few more minutes. If you want to introduce yourself, please feel free to use the chat, or you can just talk. I think Ali is trying to connect to the audio, but I'm not hearing you.
I see Dr. Webb joined us. Hello, Candace Webb, how are you?
Hello, I'm good. Thank you for the welcome.
Oh, thank you for joining us.
I appreciate the invitation.
I was just asking everybody if you can introduce yourself, just a brief introduction, so we know who we have in the room.
Hi, yes, so I'm Candace Webb. I work for the Department of Health and Human Services now in the Health Resources and Services Administration. And I work in the Bureau of Primary Health Care on our health IT team. So we support community health centers and federally qualified lookalikes to leverage health IT to improve patient and provider satisfaction. And I most recently worked with the National Academy of Medicine with the Action Collaborative on Clinician Wellbeing and Resilience, and met Dr. El Najjar through that work.
Great. It's great to have you here.
Thanks for inviting me. I appreciate it.
So anyone else, feel free to just let us know who you are if you want to. I mean, it's not mandatory. We're just asking, you know, if you'd like to introduce yourself, you can. I'm just going to wait a few minutes before everybody's trying to kind of join in, a little bit late, but it's okay. Okay. So we're just going to continue. I think we have a good amount of people that we can continue now with our presentation. So this is a little bit of background about me. As you can see, I just explained to you that I teach in SUNY Empire State University, and I teach IT and computer science, and I have also been working in the field of information technology for past 20 years, doing consulting and also teaching various courses in IT and related fields, especially in cybersecurity nowadays. Also, I'm one of the co-founders of Connect Space, and actually, at the end of this presentation, you can get in touch with us via Twitter or LinkedIn or email, and feel free to kind of know about our upcoming workshops and events that we're going to have. So basically, I have a little bit of overview of what we are going to have before this presentation. So some of the things that we're going to focus on, we're going to talk about the overview of attacks that are being on rise actually right now. We're also going to provide a definition of cybersecurity, and also we're going to talk about some of the case studies and examples of the cybersecurity attacks and some of the hacker techniques that these hackers can get into our systems. We're also going to talk about the data breaches, what is a data breach, and also again some of the examples of that. We will talk about cybersecurity framework versus the regulatories that are in the field of healthcare. Also, we will talk about some kind of tips of how we can actually protect the data that we have as a healthcare professionals in the field. And then at the end, we are open with any questions. So feel free to, if you have any questions, you can just send it in the chat and I will review it after the presentation, or you can basically wait until the end and then we have open question and answers. So in that way, it's probably better. And I have to ask you also, during this presentation, I wanted to be a little bit of kind of interactive. So I'm going to ask you some questions too, and feel free to type it in the chat, or you can unmute yourself and talk. So just before we continue further, if you unmute yourself and talk, please mute yourself back in, because we don't want other noises to kind of interfere with this presentation. So before we start anything, we are going to talk about actually what is cybersecurity. Before going further, I just want to emphasize the importance of cybersecurity in the field of healthcare. And in the field of healthcare and other industries also, but critically in the field of healthcare, we are lacking the cyber talent that's needed in the field. There are some problems with the field of healthcare, especially that we have a lot of legacy systems and equipment that might not be up to date. Also, they might create some vulnerabilities to the patient's data, and also ultimately to the patient's care. So this is actually a big public concern, and we need to pay immediate attention to it. So if you want to define cybersecurity, we can say basically it's the process of protecting the information by preventing, detecting, and responding to the cyber attacks. Especially for us as healthcare professionals, maybe especially in the field of electronic health records, which is very important. And a lot of people nowadays, I mean, a lot of doctors, nurses, they spend a lot of time writing and documenting all the patient's symptoms and all the patient's medical information and all that, even more than talking to the patient. So they spend a lot of time recording all of these. So it is very important to protect these type of data. So in order for us to protect the data, we need to do some kind of a secure, we need to make sure our data are secure, and also we need to ensure the security and safety of our patients' information if we want to give them a quality of care at the end as well. So as we know, the cyber attacks are on the rise, and actually cyber attack on healthcare is #1 cause of the data breaches in 2020. So there are about 41.4 million patient records that have been breached in 2019, and that has increased by around 50% in terms of hacking these systems. Ransomware, which we're going to talk more in detail, malware, and denial of service attacks are some of the top cyber security threats that are facing a lot of healthcare organizations. And as I mentioned before, the healthcare industry is actually a #1 target of cybersecurity attacks in 2020, and FBI and Department of Homeland Security also warned in May, especially because of this COVID, that these type of research that's happening in COVID and vaccines and all of that has been targeted throughout this whole crisis and more than ever before. So we are just going to look here in terms of the era of basically e-health consumptions, or kind of an e-medical record consumptions. We are now using the technology here to be able to expand access to do e-care. Even as we speak right now, it has increased more even from previous year. So now, as many of you know, there are a lot of companies and software companies, and also there are a lot of healthcare organizations that they have turned their kind of a doctor-patient kind of a consultation to the online platform in terms of either mental health, or even in terms of just day-to-day, you need a prescription or you need to see a doctor. So a lot of this is happening through also email, through Zoom, through different way of connecting to the patient and doctors together, and also even e-prescriptions and things like that is becoming more common nowadays. So the patient is also getting empowered by use of these technologies, and also they want to take advantage to get better cure, and also get a better wellness experience. So other things that are in this era of e-health are electronic health records, and there are systems that can have either also administrative systems and as well as the financial systems. So a lot of that are now electronic, online. So you might not even go to the doctor's office to pay for those prescriptions or to pay for your doctor's visit. You might just do it through the e-payment online system. So all of this are great, maybe for us as users, and also maybe for doctors. They are awesome technologies and awesome maybe ways to communicate and help the patient and see the patient, especially in this time of crisis. And also, I will see that in the future as well. But this will bring a lot of threats for us. So I kind of talked to you a little bit about some of the technology, but here are basically some of the new emerging technologies that also they are increasing the cybersecurity risk for the patient and the healthcare entities, like using the portals. A lot of us nowadays, we log into the doctor's portal, either through our mobile or through the desktop. The patient has access to the medical records, like as soon as you see the doctor, all the data from the doctors is going to be recorded in there. You will see all the notes the doctor took, all the prescription they gave you, all the information that they gave you. So a lot of these portals are now being implemented. A lot of them are going to be available through mobile as well as the web. Also, a lot of care management systems are being developed in terms of following up with the care, in terms of maybe even trying to pinpoint the problem by looking at all of these data and using the AI to kind of make a better decision about the patient's health. So again, we are talking about a lot of data that are being held on the system. And nowadays, maybe you have heard about cloud computing, and now a lot of companies are storing the data on somewhere on the cloud. It could be a virtual cloud or a public cloud, but still the vulnerability of those systems needs to be tested. So all those patients' records is going to be somewhere on the internet, and that will bring a lot of vulnerabilities to the system. Also in the fields of robotic, we see that we are actually, the technology is actually helping a lot of doctors and nurses as well to use these robots, even in the surgery, in the robotic surgery. But again, all of these are generating a data that is need to be secured and be able to manage it. We also nowadays, we have a lot of wearable technologies like a smart devices that we'll use like a smartwatch or things like that, that we also using a lot of patients' data to record, like, you know, your day-to-day, maybe if you have a medical conditions, your daily heart rate, or maybe other information that might be related to the patient. And they could actually save people's life, but on the other hand, it could be a threat that somebody can get a hold of these data, and again, you could be vulnerable. So this is kind of, this slide here is kind of showing the overall of all this technology and how people are kind of interacting with it, and how it could increase cybersecurity risk. With that being said, healthcare data breach, actually, they rose a lot. There are about 6.2 billion lost by US healthcare system in 2016 due to the data breaches. And there are about, the healthcare data breach case, 380 per records, or actually about 2.5 times more than global average cost in the other industry. So the amount of, in terms of money-wise, the amount of dollars that we are actually losing is more than the other industries. So it is worth it to spend more money to secure our data and to have a talent to be able to help securing these type of systems. So the breaches can have impact on the basically more than 1 million patients and a lot of different health plan members as well. Every time that the breach happens, the organization are responsible to kind of notify the people or the people who have their data got breached out or something. And that also has some cost to it. That cost is about 500K on average. If you can see here, like about 90% of hospitals have actually reported a data breach in past 2 years. So nobody is safe, to be honest with you. And about $4 million average cost of a single data breach across all the industries, if you want to, not only the healthcare, but all the industries together. Also, our data worth money in the dark web. So this is just an example. Maybe social security numbers worth $1, but a medical ID is actually worth $50. I just want to pause here for a second, and I just want to ask anybody, do you know why this is? Do you know why maybe our medical ID number is worth more than our social security number in the dark web?
Someone can use it to prescribe medication? I don't know. You mean like the NPI or the or what number? Like my medical information as a licensed
Yeah, your
physician?
medical information ID number. Why do you think that could worth more than just a social security number in a dark web? Why people might sell that?
To insurance companies, you use it for like as a provider, as a bill underneath it, under that number. I don't know.
Okay, good guess, but so you know that in a dark web, people, they sell these, like hackers can actually hack your system, and basically they can get your social security number, date of birth, you know, all kinds of financial information, your tax record, your tax IDs, and also your medical ID. But why that is worth more is because once they have your medical information, they can actually use something that we are going to talk in next slide about ransomware. They can actually ask the hospitals to pay. And because these are very important, and also there are a lot of regulatory around that. So if people lose information, they can actually be fined a lot of money because that's private information and all that. So they can actually ask hospitals to pay them, or the medical health providers to pay them tons of money in return of actually giving back the medical ID, or kind of say, okay, your system is secure. So so the kind of your street value of medical ID is more than even social security. So that's why it's very important that we need to protect these medical information data. There are some tools out there. This is actually from, there is a good website, healthit.gov, that you can look. And in that healthid.gov, they talk a lot about HIPAA. So they have a security rule toolkit that you can play around. And also this is a very good tool for maybe the government organization and the healthcare organization to look at the security risk assessment and play with the tools to kind of find out are they in risk? If they are in risk, about what percentage, or how can they mitigate the risk? How can they bring it down? What are the things that they can implement? So these tools are available from healthit.gov. You can actually go to these websites and download them. And it's actually helping healthcare organizations and providers. Another thing that I want to talk to you is also before getting into data breach, I just want to mention to you that about 4 in 5 doctors experience some sort of cyber attack. So a likelihood of a cyber attack to happen to a doctor is a lot, is about 4 out of 5 doctors. So what do we mean by data breach? And why is it important to us? Why do we have to care? Basically, data breach could be intentional, or actually it could be unintentional release of secure or private confidential information to an untrusted environment. Basically, your data could leak out. So this is actually important to remember. It's both unintentional and intentional release of secure data. It's not like sometimes that we want to release data, but we don't know, and we are releasing it as a healthcare provider, as a nurse, as a doctor, just unintentionally. It just happens, and we need to be careful about that, and we will talk more in details about it.
Lila, I have a question about that.
Yeah.
Do you know if if your social media presence make you more under risk or not?
Yeah,
like if you are revealing your identity on the social media, that make you more at risk?
Yes, that is also makes you more at risk. The more information you have over there, the more you're going to be at risk. So So that's why, like, there is something like, for example, for all these kind of a retiree centers and all that, there are actually laws that prohibit like those centers to even have social media for their residents, like the elderly residents, even though a lot of people, they want to, they cannot use the system, and they should not, they are kind of telling them not to have a social media because they don't want to be a risk to even use their network and have a social media presence. So yeah, you are going to be in more risk as well. So there are various type of cyber attacks. There are many ways that the data breach can happen. One of them is ransomware. The other one could be just unauthorized access. The other one could be malwares, which we're going to talk more in detail. And another one is social engineering, which also we will talk more in detail. And the simplest one is theft of digital assets. Actually, somebody can steal your computer, steal a computer that you're using at work, or steal your mobile that you are using for work, or something like that. Steal maybe just like a USB drive or a CD or something like that. Just a basic things that could happen. So what is ransomware? So now for these few slides, we are actually going to talk about various type of cyber attacks that can happen. One of them is ransomware in healthcare. Basically, ransomware is a type of malware that can encrypt an entire computer or basically your system altogether, and then demand a payment in exchange for the encrypted key. And this is very, very common right now. This is actually #1 cyber attacks in terms of field of healthcare right now. So the hospitals and healthcare providers, they are target for the cyber criminals. And because they need to have access to up-to-date information. So the cyber criminals, they know that these hospitals, healthcare services, they have the up-to-date information, all kinds of information, your phone number, your driver license, your PII, your health information record, your medical info, everything for the healthcare needs to be up to date. So they know if they are attacking that system, and they are going to get the up-to-date information. So, and also because of all these laws, and because they don't want to compromise the people's privacy, they are willing to pay the ransom. So this just happened to Florida Orthopedic Institute, and about 640,000 patients' record was actually kind of like on this attack. So around 400,000 new strains of ransomware are detected daily. So it is making it very hard for the cybersecurity professionals, and even FBI is involved, to be able to actually respond to it. So this is just one example. There are tons of examples like Florida Orthopedic Institute. There was also a case at Hollywood Medical Centers a while back that the hospital had to pay them in Bitcoin. I think it was about $17,000, but they didn't pay that much, but they still had to pay something in Bitcoin's money. And a lot of these attackers nowadays, they are using the kind of digital currency, because it's very hard to kind of track it. So they can say, just give us money in Bitcoins, and they can use it any way they want. So around 50% of hospitals are actually affected by ransomware, and about 25% of the hospitals, they don't know if they have been affected at all. So the other example of a cyber attack is actually malware in healthcare. So malware can be any software intentionally designed to cause damage to a computer or systems, or a computer network. There are a lot of malware types that exist. they call them like viruses, worms, Trojan horses, spyware, again, scareware, all kinds of things are now happening in field of cybersecurity and in terms of malware. Again, there is Encourage Community Mental Health Services that they actually had to pay around $150K because of the data breach that happened to them using malware. So malware infection compromised the records of around 3,000 individuals. And sometimes this happens because the companies or the healthcare institution or the hospitals, they don't review their systems for unpatched and unsupported software. So especially if you have a legacy systems and you have some records there and you don't patch your system, so that will have some holes for the hackers to kind of get into it. So it is very important to actually just run regular updates and updates of your patches. Just a regular antivirus software, just patch your systems. But these simple things, they often sometimes being ignored. And that could have a major implications in terms of paying a lot of fines for that. Another example of cyber attacks is actually email phishing, or we call them sometimes phishing, which is also nowadays phishing is actually type of a social engineering that steal user data, including the login information, credit card numbers, and all that. And that could occur when an attacker acts as somebody else or as a trusted entity, and then kind of make the victim to open an email, to open an instant message, to text a message back. And in that case, the attacker can actually attack your system and get those valuable information. The University of Washington School of Medicine had a data breach after a staff member actually opened an email that had a malicious software. So you see a lot of people, they do it unintentionally, and this happens. It's not only happens to the hospital, it happens in the schools, it happens in the universities, it happens in even Google and Facebook. A lot of cyber attack happens to them, and somebody just the other day told me, if they cannot protect their system, how can the other people? So it is true. Nowadays, attacking somebody's computer is not as hard as it used to be, and there are a lot of softwares that are out there that can be used, and also they can actually trick you into providing information just for yourself. And so that's why training the employee and the staff is very important about these type of things. And also just basic security updates is always very important. Even we are gonna, in a few slides after, we're gonna talk about password and how that is actually very, very important. Just a basic password that you choose. So around 100K digital health records were accessed and compromised. So they had to actually do a settlement with patients around $750,000. And these numbers are huge because sometimes HIPAA can actually fine you. Sometimes, you know, the patient, they can take the organization to the court. It just happens. So, you know, everybody has to be careful about these type of things. And training is the most valuable things that every organization need to do, and continuous training, not just one-time training, continuous training, continuous reminder for having a strategic plan, having a basically kind of a risk assessment plan, how to assess your risk, how to be able, if something happened, how do you able to recover your data, talk about disaster recovery and all that. So another example of cyber attack is actually data theft. As I mentioned, maybe just somebody physically steal your computer or laptop. So that's why it's important to have an end-to-end protection and encryption of your computer. So the theft of laptop of this HealthCare of Oregon actually also compromised 650,000 patients' record as well. The theft of laptop showed that physical security control and vendor management is needed, and need to pay attention to the cybersecurity part as well. So the laptop was encrypted, but the stolen device contained patient's name, details, date of birth, medical ID numbers. So once the attackers get this, they can actually sell all this information in the dark web. And as you saw in the previous previous slide that I had, that the medical ID records, for example, cost $50 to just sell one record. So you can see they can make tons of money just selling the stuff in dark web. And employees are.
Leila, can I
Yeah, go ahead.
interrupt you for a second? There is a question in the chat.
Sorry, yeah,
There is a question in the chat asking about the difference between ransomware and is it a type of malware as well or not?
What was it? Sorry?
The ransomware, is it a type
Yes,
of malware?
it is
or
also a type of, it can be a type of malware as well.
okay.
Because it can actually encrypt your entire system, and it will lock your system with encryption so that you don't have access to that encryption key. And then they say, okay, if you pay us like $100,000, we send you the decryption key so that you can decrypt your data and have your data. Otherwise, they actually stole all your encrypt it. So they can send some ransomware, and it can act as a malware as well.
Okay, thank you for sharing that. And another question was in private, when you said the mail in the phishing section, when someone opened the email, they can just get the malicious information just by opening the email, even if they don't click on any link or anything?
Yeah, it could happen, yes.
Okay, thank you.
So that's why, like, I mean, you should see the title, and I will show you an example of phishing. A lot of you might get it. I mean, if you have a PayPal account, you might get tons of phishing from PayPal. And it happened to me. I actually clicked once. And I mean, I'm kind of like, we have a class that we kind of show basic cybersecurity, and the students can actually go through all these emails and links that comes to them and say which one is kind of phishing, which one is not. And we do a lot of practice with that. But at one point, it looked like exactly what it was that I just click on it. And sometimes it happens. So I just want to, we will go over a few examples of that as well. So employees are actually your weakest security link. There is a study by IBM that says 95% of data breaches are actually caused by employees' mistake. These mistakes can, employee can actually fall into victims' hands through a phishing or ransomware, either both of them. Losing a laptop, or maybe also a smartphone, or basically send patients' information to a wrong recipient. And this happened actually in public schools, few public schools in Florida just past few months, that the person who was working in the admission accidentally sent, actually this person used social engineering to act as this is a kind of a authorized person who should have access to the student's record. And this person, the payroll person, actually send employees' information and also faculty's information and also students' information to this person, and the whole school system was under attack. So this just happens, and employees can get tricked into it. Also, another weakest link is medical devices. Nowadays, we are using tons of medical devices, as you doctors might know. There are about 36,000 healthcare related devices in the US alone that are actually being discovered on Shodan. Shodan is actually a search engine for connected devices. So Shodan actually exposes the IP addresses of internet facing hardware, physical location, the ports that they use, the operating system that they use, all of this information that makes the attacker to kind of attack your system very easily. St. Jude Medical, which is actually a manufacturer of some of the medical devices, actually fall out of vulnerability in some of the company's defibrillators and pacemakers and other electronic devices as well. So the attackers could actually hack the insulin pump and to actually administrate a fatal dose, which is very, very dangerous. And this could happen, you know. So one of the cybersecurity concern is actually about having tons of medical devices and having them exposed online to the attackers. Vulnerable medical devices connect to a large array of sensors and monitors, making them potential entry points to a bigger hospital networks as well. So once the attackers can actually kind of get into these medical devices, it makes the entry for the attackers to actually attack the hospital system or attack the bigger networks. So they can just log in through these devices and then make their way into actually attacking the hospital networks. So in here, I'm actually going to ask you guys to kind of look at this for a few minutes, and let's see what we want to have here. We are actually going to look at a threat, and we're going to look at vulnerabilities, the impact, and we are actually going to look at the practices. So a threat, actually, I want to talk to you in terms of medical terms, if I can try. The attack is actually, the threat could actually be influenza, or it could be like COVID, you know, that will attack your system, the influenza that you might get. The vulnerabilities could be weak immune systems. So when you think about vulnerabilities, it's a weak immune system that you might have. Or you could have, because you didn't get a flu shot, maybe that's your vulnerabilities. Or maybe you don't wash your hands as often, you don't use the hand sanitizer. So all these make you vulnerable. So those are the vulnerabilities in terms of medical terms, if we want to think about, right? So the impact of that would be that the patient gets stricken by the flu or by this COVID virus. So the practices will be basically receiving either the flu shot or maybe a vaccine that might happen soon, or wash your hands, or basically use the hand sanitizer. So these are some of the practices that can happen in order for you to actually not get this threat, right? Which is the influenza or the COVID. So now let's put it in terms of cybersecurity. Now let's put it in terms of email phishing attack. So the vulnerabilities, so when the threat happens, for example, this email phishing that we're talking about, lack of IT resources or managing suspicious email. So maybe, a lot of organizations nowadays, they have a system that if it's coming from a known source or if it's not in their whitelisted source, they don't even send it to the network of the organization. They just send it to a place that's called like junk mail, or sometimes it says like red flag emails or something like that. But if you don't have a system like that, you might get all the email messages to your mailbox. So one of the things is lacking of that IT resource to kind of look at it and say which one is safe, which one is whitelisted, which one is not whitelisted. Also, you might not have a lack of software scanning. So there's no antivirus, there's no the firewall that you have in your system or something like that. So basically, you're lacking that. So it makes your system more vulnerable. And also emails for malicious contents or bad links. So you are getting these emails and you don't know if it's the right one, and you just, just basically, you might just get a bad link that will just comes to you and you don't even know it. So the impact of it could be loss of reputation in the community. So if you don't fix your vulnerabilities, then the attack email phishing can happen. And then the impact would be your healthcare hospital, it could be healthcare organization, hospital, doctor's office, anything. You might lose the reputation that you have in community. Nobody else will refer a patient to you because your system is not secure. You were attacked, you kind of violated patient's privacy, and maybe you have to pay a lot of fines and things like that. You might even have to leave the practice because of that. Or the impact could be stolen access credential, can also be used for access to the sensitive data. And then once they get those data, then you could potentially need to pay these ransom amount of money to these people to get your data back. So some of the practices that kind of make you not be vulnerable are be suspicious of email coming from unknown senders. Train the staff to recognize these suspicious emails. Once you get them, just send it to your IT department or just notify them that this is the email that I got. Make sure that if you don't have the scanning software on your machine, make sure that you install it. Also implement an incident response to be able to manage successful phishing attack. So this is very important. Like once incidents happen, you have to report it. And once you report it, it goes through a set of different IT systems, and they actually will implement a incident response plan, how they would respond to this. And so maybe some part of the network is attacked. So once you report it, then they can actually secure the rest of the network. So you're gonna still lose maybe some data, or maybe your system might compromise a little bit, but not to the whole bigger picture. So you're actually minimizing the attack.
I have a question about that. Is it like, would you think some physicians would feel like scared of reporting it because of the consequences, or
Yeah, it
or
could.
do you know any policies?
Yeah, definitely. I mean, it's not only patient, doctors, even anybody who works. I mean, even me as an IT person, like once that happened, I was scared to call my IT department. I said, oh my God, they think like I compromised their system. But I kind of reported it, and then they have it in their system and they kind of respond to it. So, and you need to have that training to kind of, the hospitals need to provide the training, or the medical center needs to provide it, that if an attack happens, you need to have an incident reporting. And that incident reporting makes that they have a response team that will respond to it immediately. So it will kind of make your system more secure, and then your other part of the system is not going to be attacked. Otherwise, it's going to be a huge problem. So reporting is very important. Doesn't matter if you're doctors, if you're just employee, if you're a front desk worker working there, or if you are a patient or anybody, but they need to report it. And that's one of the things that maybe you don't see a lot. And this needs to be in the policies and procedures of the cybersecurity plan, and also in the training that the organization they provide. So threat, vulnerabilities, impact, and practices is very important. The same example as I gave you for the, the COVID, the influenza virus, you can apply it to any type of attack that happens. So we need to have the practices in place. We need to make sure what are the vulnerabilities and how we can actually attack those vulnerabilities and how we can fix the vulnerabilities. The next thing that we are going to talk about is challenges to the healthcare systems. I talked briefly at the beginnings about some of the challenges, but there are a lot of challenges to the healthcare sector in specifically comparing to the other industries. As I mentioned, we might have a lot of maybe nowadays their hospitals are kind of up to date, but a lot of doctors' offices, like they still have some old legacy systems in place, which actually could cause a lot of problems. Also, a lot of medical devices, we just talked about medical devices, that's a big link because they actually internet enabled. So they might be connected to a virus network that might not be secure. So, and a lot of doctors' offices, they might have, all their systems connected to the internet. So people, they know their IP address, they know actually which port they are using. So it can actually open up a lot of vulnerabilities. So I actually went to my dentist a few days ago, and he said, and that's what he was kind of mentioning to me, that he doesn't want his staff, anybody at the office, to have access to the internet. But on the other hand, he has no choice because, there are nowadays a lot of things is happening and they need to change. They even have a system that comes through the patient portal that needs to be connected to the internet to get updates regularly. And so he was thinking just to have one system that's separated from the other networks that he has so that it can be secure by itself. So in a separate system, you can have that network connections, and then for your other devices, it should not be internet enabled. There are other mandatory transition from paper to electronic health records, which again, that is also a challenge. So now you're gonna have everything, all the data in electronic format, which is great in some sense. All the patient will have access to it. It's so easy. You can actually do a lot of data mining with it, use a lot of AI to make sense of the data. But on the other hand, it's opening a lot of threats. Victims are often unaware when the phishing is happening or when something happens. Again, this could happen. You might not even know, so you don't even report it. And this happens, as I mentioned, 25% of the organization, they don't know it happened to them until maybe years later. So, or months later, or maybe a few days after. So, but the ones who know, they need to report the incidents in order to be able to manage the response to it immediately. Third-party vendors with network access, again, that also, maybe the insurance provider have access to your network. Maybe another third-party vendors that are selling their devices or, medical equipments, they might have access to your system. Again, that is also a challenge. And then also you have another challenge is because a higher payout on the black market. People on the black market, the medical records is worth more money. So if you lose a social security, maybe it costs $1 on the black market, but if you use a medical ID number, it could cost $50. So again, that's why it's another challenge that you need to, the healthcare systems, they need to secure their network. And also, healthcare is actually the only systems that actually stores and combines the PII, PHI, and PCI on their system as well. So the next thing we are going to talk about, the regulatory frameworks and the security frameworks. So in the the regulatory framework, the PCI, the purchasing systems, they have, when you pay, like when you pay your medical records and all that. They have a framework, and also HIPAA, which was established in 1996, is a framework that a lot of organizations are using. And the security frameworks are ISO. We have the ISO, which is one of the standards and framework for the cybersecurity. They actually have a standard for a lot of things, but for cybersecurity, they have a standard as well. And also NIST, National Institute of Science Technology, they also have frameworks for the cybersecurity, and as well as high tech. I think I'm just gonna stop here for 5 minutes break. If you want to take 5 minutes break, you can, and then we just come back at maybe 3 o'clock. Is it okay for everyone?
Yeah, thank you, Layla.
Yes.
No problem.
Meanwhile, if anyone has any questions, please keep them coming in the chat and I'll pass them along as well.
Yes, please. Okay, everyone, I'm back. I hope you just took a short break and kind of refresh yourself. Sometimes these topics are kind of like, you know, there are a lot of information to observe and a lot of terminologies and a lot of abbreviation, actually, I find in the field of IT and also in the field of healthcare. So let's go back. So we were talking about PCI, HIPAA, high-tech, ISO, NIST. So we were talking about the regulatory and as well as IT cybersecurity frameworks. So the PCI DSS is Payment Card Industries, and this is a standard for protecting payment systems from breaches and theft of cardholders. So this is when you are actually using your credit card to handle some payment, financial payment. HIPAA is actually a Health Insurance Portability and Accountability Act legalization that was developed in 1996 and provides data privacy and security provisions for safeguarding the medical information. So at that time in 1996, a lot of even when this act actually came, it cost a lot of companies tons of money to change their system. Because before that, everybody's database, everybody's back-end system were using like something like social security number. So when this act happened, they all had to kind of come up with some sort of an ID, unique ID, other than the social security number. So they kind of all changed that, and also this Privacy Act. So now they learned that all the medical records, everything has to be private, you know. So you how to make sure you actually take care of it, put it in a secure place. Don't give out the information, you know, don't make sure that that person is authorized to know. So ask them a lot of security questions before you give them personal information. So tons of things happens because of the HIPAA Act in 1996. A lot of you might not know about this high-tech actually act, because this is very new. It's not very new, but a lot of us might not know because it happened in actually 2009. So it is kind of new in terms of if you want to compare with HIPAA and the PCI and all that. So it is a health information technology for economic and clinical health. And this was actually as part of American Recovery and Reinvestment Act of 2009. So what does that mean? Like, what does it do actually? One of the things that this HIPAA Act was created was to promote the adaptation of health information technology, especially in terms of using the electronic health records. So this act is actually provided a lot of security component in terms of having more audits, having tougher fines, enforcing it, making people more accountable, you know, minimize the necessary disclosures. Sorry, I have to admit one person. And also marketing restrictions. So as of this act, a lot of things happen in terms of, you know, having more audits, more informants, and even HIPAA fines, they actually changed that. So it's tougher fine that the organization needs to pay. For ISO and NIST, these are actually cybersecurity frameworks and standards that when you are actually implementing a cybersecurity in your organization, you actually follow either NIST or ISO standards. And based on that, you implement a cybersecurity policy and procedure in your organizations. Most organizations in the healthcare, they actually follow the NIST standards. And it's very common standards that they kind of follow when they are implementing a cybersecurity policies and procedures in their organizations. So as healthcare professionals, we need to be kind of familiar with these three. For these are kind of more IT and cybersecurity for professionals needs to kind of be familiarized with that. So that's why I decided we are going to focus more on the HIPAA and High-Tech Act a little bit more. So the HIPAA privacy is actually focusing on the privacy rule. So the standards for privacy of individually identifiable health information, and that this rule actually establishes the first national standard to protect patients' personal health records, which is PHI. So PHI stands for Personal Health Information. And that requires you to make sure that you protect the privacy of personal health information. Also, the privacy rule sets limits and conditions on the use and disclosure that in that way, you want to make sure that those such information is not with patient authorization. So you want to make sure that the patient authorizes that these informations are going to be disclosed. Also, it gives patients rights over health information. So including right to look at it, obtain a copy of their health records, and also if something is wrong with it, request correction to it. So the HIPAA privacy rule is good also for patients in terms of giving them right to have the access to the health information, to give them the right to have access to it. HIPAA also has security rule, which establishes a national set of security standard for protecting important patients' information as well. So that's same as PHI, and making sure that you are actually, you need to secure this PHI. So the electronic PHI form needs to be kind of physically protected in terms of giving the correct access. Not everybody should have access, of course. The authorized people should have access to this information. And also in terms of making sure that all the patches has applied to the system that is recording this PHI, that is storing the PHI information. And making sure that ensuring the confidentiality, integrity, and availability of all electronic PHI patient health information. When you create it, you want to make sure that it has a confidentiality right, it has a integrity right, and it is also available to whom it needs to be available, you know, to the authorized person who needs to be available. And also in terms of receiving it, once you receive, for example, if a hospital is sending the ePHI to another hospital, the hospital who is receiving it also needs to make sure follow this rule, and also maintaining it and transmitting it to maybe a family doctor or something like that. So all of these needs to happen in a secure environment. Also identify and protect against reasonably anticipated threat to security or integrity of information. So you need to make sure that if somebody got access to it, you need to identify it, who that organization is or who that person is. I mean, you are responsible, your organization is responsible because you as a healthcare provider needed to maintain HIPAA security rules. Another thing that you want to make sure is the notification rule for the HIPAA. So you need to actually make sure if somebody got hold of somebody's record, you need to actually send the individual notice in a written form. And if contact information for 10 or more individual is sufficient, then covered entity must post on the homepage of the website for at least 90 days or provide notice in the major broadcast, or they need to announce it. So if anybody, more than 10 people's PHI got compromised, they need to actually post it on their website, and they need to notify all of these patients and also broadcast it. Breach affects more than 500 people in a state, it requires to provide notice to prominent media, also notice to the secretary, and also they need to notify via website. So there are a lot of rules and regulations that HIPAA has put that the organization, especially hospitals and healthcare organizations and private practices, needs to follow. And if they don't follow it, they are going to get a lot of penalties for it if this happens. There is a OCR. It's good to know about OCR, or Office of Civil Rights. So that is actually office that deals with PHI, allowing those without a direct need to access to the data, lack of safeguarding of PHI. It deals with that, with encryption of your data. It deals with that ability to remotely wipe a hard drive. If it knows if it's compromised, they are the one who can authorize that and do that. If the patients are unable to access their data, then they can also notify OCR, and OCR can deal with that. Use of disclosure or of more than the minimum necessary for the PHI. If a healthcare provider is actually asking you a lot of disclosure, and it's more than what it is necessary about your PHI, then you can also report them to the OCR as well. And if you know that that medical center or that hospital is doesn't do the safeguard of your records, again, you can report them to the OCR. So OCR increased the fine based of negligence from $100 to $50,000 per record. So it could be a lot of problems if even a patient reported to the OCR and then they do the investigation, and if they find out that there is a negligence on behalf of the organization, then there is a lot of costs that they need to deal with.
I have a question here. So we have a lot of the HIPAA. So we get training about HIPAA when we start every year onboarding. And I guess this year it's different for some of the trainee and the onboarding staff, because there is some of those HIPAA regulation got waived with the pandemic, but still there is liability, and some people are not aware of the liability still there that's being waived during the pandemic. Doesn't mean the liability is falling apart as well. Have you read anything about that with the pandemic?
With the COVID? No, I haven't. I don't know like that much. I mean, I know about HIPAA. Since 1996, because I had to deal with the IT systems that needed to be HIPAA compliance, but I don't know exactly about if they waived the fines over the COVID. I'm not sure. But the fines.
No, so they waived some of the regulations, not all of them. So, but I just don't want people who are attending here who actually practicing outside to think about the waiver as an all or none situation. And it's like you gotta have to be careful, even though some of those regulations has been waived. For example, waiver of those HIPAA regulations will allow you to, from telepsychiatry perspective, to use a non-HIPAA protected platform. Yet, right, like if you have the ability to use the HIPAA protected one, it is really important to do so, because that's part of the situation right here. That it's like it got waived initially in March, and now we have to be careful with the waiver regulations, and it's also different from a state to another. So that also I wanted to put it out there.
Yes, thank you so much for your information. Yeah, it's always good to know from somebody who's practicing the field, because I don't practice in the field of the healthcare, but I know it from the IT perspective, and I know about some of the compliance that the systems needs to be, but I know like that's why we are kind of saying that also. Like this example here, as you can see, from year 2008 till 2015, that actually it got increased 300% increase in the fines if you are non-compliant. And there are a lot of settlements that happen. So in 2016, the total fine was $5.5 million penalty. So cost of HIPAA violation, this is actually pretty new, but I don't think it doesn't include the pandemic waiver or anything like that. So there are different tiers. I mean, as I mentioned to you, if they find you kind of negligence, like you knew but you didn't do anything about it, then the cost is much more. So the tier 1 is if you are unaware of the violation. So the cost is between $100 to $50,000. Maximum cost is $25,000 per year. But the tier 4 is if you know willful neglect of HIPAA rules and you didn't have any effort to resolve it within 30 days. Then that cost could be a lot, as you can see here, $1,500,000 per year. So they have different tiers, and they actually give you, I mean, it's not like if something happened, like you were unaware of it, they give you sometimes to fix it. And if you don't fix it within 30 days, then you could move to tier 2 and so on. So there are, that's the whole thing, you need to be aware of it. They are these, like when we talk about, doesn't matter in field of healthcare or in terms of cybersecurity, we talk always in the IT security standard, we talk about 3 Ps. Policies, procedures, and also practices. So the policies is what information you are looking at in a timely, relevant manner. So all the doctors, nurses, they all have policies, right? They all will look at the policies. So in terms of cybersecurity, they also have policies that they can defend against the current threat landscape. There are procedures. This is how we do it. Procedures deals with how we do it. So there are steps that you need to do in order to be able to prevent the threat or minimize it. And also practices. This is the proof. Practices, we always talk about the proof. It's the evidence that you practice those procedures that you have. It's good, maybe you have procedures, but if you don't practice it, then attack can happen too. So every organization should have policies, procedures, and practices to follow. Same as any doctors and nurses in any type of healthcare, they have policies, procedures, and practices. It's the same way in the field of cybersecurity and securing your data as well. So also when there are 3 main principles of data security. When we always talk about data security, we talk about confidentiality of the data, integrity of the data, and availability of the data. So making sure that your data is not going to be public or give it to the unauthorized person. You want to make sure that you have access to your data, but not unauthorized person. So that deals with confidentiality. Integrity means that your information is correct. So that's why we had it in one of the HIPAA Act, that the patient has the right to actually tell them to correct their data if it's not correct. So integrity is accurate, being completed, and is protected also from unauthorized modification. So that's why sometimes maybe a hacker might actually get access to the healthcare system and change the data. So that could cause a lot of issue in terms of even caring for your patient. So if they change somebody's blood work, you know, it could be fatal. So this is very important in terms of security of your data. And availability, ensure reliability and timely access to the data as well. You want to make sure that the data is available when it's needed. So if you need it right now, I mean, if the doctors need to access the data right now, they should have access to it right now, not tomorrow, you know. And also it needs to make sure that authorized individual has access to the available data. So these are just the 3 main principles of data security. It doesn't matter if it's a healthcare data or any sort of data. But in healthcare, it's very important, especially in terms of integrity, confidentiality, and availability, because all the patient PHIs, they need to be up to date, they need to be always available, because it can affect a patient's care and also the outcome of that patient, you know. So what to do to avoid the OCR fines? OCR, as we said, they can fine, even if the patient complains to the OCI, they could actually fine the organization and the hospital. So make sure you have a comprehensive risk assessment and risk management program. So as part of the policies and procedures of your healthcare organization, your office, you know, your medical practice, you need to have a risk assessment and risk management program in place. You need to document your policies very well, and you need to make sure that the basic technical controls in terms of security of your data, in terms of, you know, having some antivirus softwares, making sure that you need some password protected things in there, some basic, and you need to have at least some fundamentals of technical controls in place if you want to avoid the OCR fines. So now we are kind of at the end of our presentation. We still have a lot to go, but these are actually some tips that I want you guys to think about it and maybe write down for yourself in terms of maintaining physical security of your device. So nowadays, especially if you are working at home, maybe you're providing healthcare to a person at home using your mobile. So you want to make sure that you don't store passwords, script on your devices if somebody get access to that device. Back up your device regularly. So if you know, something happens to it, you have a backup of your device. Maintain up-to-date virus protection actually for yourself. And when you print something with protected health information, anything that deals with the PHI, you must make sure that you secure it somewhere that's very secure and safeguarded. Other things, maybe some of you might say, well, what are the confidential information? You might know about just the PII, but I don't know if you know about PHI or IIHI. So I'm gonna just explain to you all of these things you need to know about it. So you need to know about the confidentiality. PII is actually personal identifiable information, and it's a unique identifier. So you need that in any database to make sure that this person's records is unique and it's not duplicated somewhere. So it can, so any type of record could be identified with this unique identifier for this single individual. PHI is protected health information, is any information about the health status in terms of healthcare or payment information that can be linked to this PHI. So, to PII. So this, anything that deals with the patient's healthcare status, any documentation regarding the healthcare of this person, any type of payment that this person made is also called PHI. And IIHI is individually identifier health information. It's actually a subset of health information. And that is including demographic information that collects from an individual. A lot of people think this demographic information is not confidential, but you need to have a disclosure if you want it, you know, if you want this information to be disclosed. Basically, social security number, tax ID, PHI, all of this are actually considered confidential, and they are all personal identification. So as I mentioned to you, probably in the field of healthcare, we don't use social security number as an identifier. We use personal health identification as a unique identifier. But in maybe other places, they use the social security number or tax information. These are all confidential information, and you should not give it to anybody else. Passport security.
Leila, can you comment a little bit on the social security number? Because I think we get asked a lot about our social security. Almost every job I applied for and I started onboarding, I got asked for my social security number. And sometimes I don't
Yeah,
feel comfortable
when you
writing
actually,
my social security number on the paper. Is there a way to get around that?
yeah, you don't have to, I mean, once you get hired, they need to know your social security number to make sure you are authorized worker in the United States. But before you get hired, you are not required. They should not, it's not a required to report your social security number. They can ask maybe your last 4 digits of your social security number, but your whole social security number, you should not provide it to anybody. And they should not ask for it.
And even after the hire,
Yeah.
if
I mean,
they
once you pay, once you fill out your paperwork for hiring, I mean, once you already signed the contract and because they need to check you are authorized or not, right?
Yeah, but I'm asking about the way of collecting the number of so sometimes right now with everything being electronic, and there's people will send you the form via email and then you send it back via email. Would you be able to, I think every institution have their own policies, but would you able to speak a little bit about the if there's a safer way to exchange that information after the hiring?
The way they do it through the email is definitely wrong. They could actually compromise the system. It needs to be in a secure portal. If it is in a secure portal and you can provide it, or over the phone if you contact the HR person and you know this is the HR person, you can provide it. But I would not, I mean, if you are filling out the form to send it to them, I mean, they can say they need it for hiring, but your social security number can be compromised if those, your emails are not secure. I mean, if you send it from your Gmail or something like that. So it's, and they are, I mean, that's the whole thing. Like they can ask, they should not ask for it before you get hired, but when you get hired, they are nowadays asking you to fill out your social security form and send it, and through the institution email, and it's not safe. And they cannot, and I know they do it, this is the practice, because even for us, like sometimes, you know, we used to before had some numbers that we would save, even the student's ID on our computer, and then we have the organization, they have some PII scanners that they scan, and if there is some personal identification on your computer, they wipe it. So the organization, if you send it from the email of the organization to the email of the organization, they normally have some PIR that's not going to be recorded on somebody's PC. But when you are sending it from your Gmail, you know, your Gmail is hosted somewhere, or your email is, Hotmail is hosted on the cloud, it could easily get out. So, and I mentioned Social Security is worth $1 on the dark web. So, I mean, a lot of people's Social Security numbers has been compromised, but we don't know that. But if an organization finds out for sure, they have to notify the people. So that's.
Thank you. Thank you. That's
Yeah.
helpful.
So for password security, you need to choose a secure password. Don't write it down. A lot of people, because nowadays we might have so many passwords, we might write it down. There's also a very bad habit that we might actually write it in our phone, in the notes section of our phone. And remember, if you lose this phone, then all your password is in there. It's a problem. You need to place it in a secure location. Make sure every time that you, you know, leave your computer logs off. You log off out of it or lock it. Change passwords often. Don't use the same password in everywhere. Don't email or share your password with even your buddy. Or a lot of people might do that. I remember I used to work in a company and at the help desk, and some other colleague of mine used to ask everybody's password because he wanted to work at the time that they were not there, and it was not secure. And then after, the manager kind of found out, and he got into trouble because that password needs to be only known by that person. So don't try to ask somebody's password, or don't try to share it with somebody. Don't store your password in places that people will find. So I just want to ask you, before we get to this password thing, which password do you think is secure? Do you think if I say to you this phrase, this is my laptop, this is my password, like this is my laptop, a phrase, or I give you a string that has capital, that has @ in it, and it's like 8 characters long. Which one do you think is more secure? The phrase, or that eight string that has capital and also has maybe number sign and things like that? Anybody want to guess? And Ala, I'm not seeing a chat. If somebody is guessing, can you let me know?
Sure.
Nobody wants to guess?
I can guess.
Okay.
All of them?
Both of them? No. Definitely one of them is more secure. A phrase, well, let's see. Let's look at the data. So the password minimum of 8 characters is, people can actually hack it in 10 to 52 seconds. If you have upper and lowercase, people can actually hack it in 45 to 180 minutes. So make sure at least you have upper and lowercase in your password. If you have numbers to it, people can guess it in 3 to, not people can guess it, but people can hack into it 3 to 15 hours. If you have some special character, it takes them 3 to 5 days. And if you have passphrases, minimum of 15 character, even if it's something that I just told you, something easy, I love myself. That is a passphrase, right? It might have 15 characters. It takes them 13,000 years to guess that. If you add upper and lowercase to it, it's gonna take them 435 million years to hack it. And if you add numbers to it, it takes them 6 billion years. If you have a special character to it, it will take them 157 billion years. So this is very important for you guys. Something that's long, even if it's a phrase that you can remember, and also if you mix it with upper and lower and add few numbers to it, and even add more special character like @ exclamation mark or something like that, it will take them 157 billion years to kind of, get to that password. So you want to make sure that you follow these kind of standards. Also, a lot of companies nowadays use 2-factor authentication. So they also have some kind of a PIN that they might send that to your phone, that when you actually sign up, it says for 2-factor authentication. In your first is your password, and then the other one could be your PIN. Or sometimes they might give you a hard token that the number changes every few seconds, and you need to have that token before you can log in. So there are also 2-factor authentication that a lot of companies nowadays use. I just want to show you a quick video. This guy is actually Kevin Metnick. He was actually one of most wanted person by FBI because he was a hacker. So they got him and he was in prison, and then he actually said, I can teach you a lot about how to protect your systems, because he knew every single holes that are in the system. So he was a hacker. Now he's actually training organizations how to make sure that their companies are secure. So let's just few minutes of this. How easily it is to crack the passwords.
Hello, everyone. I'm Kevin Metnick.
Leila, can you share the sound of your screen? If you,
Oh, you don't hear it?
no, I think you didn't share the computer sound when you shared your slides.
Let me see. 1 second.
If you can stop the share for a second and then reshare and then click on the box that share
Cold water,
computer sound.
Okay, I did it now. Can
right?
you
Something
see?
that's so easy to remember, but
Hear
so
now.
hard for an attacker to crack. Now, you can make it a little bit more complex and misspell one of the words in the sentence. And by all means, you always want to use multi-factor authentication. So when you're accessing cloud-based applications or websites, any of those websites that allow you to do so, always enable multi-factor authentication. And what I recommend is using something like a YubiKey that uses FIDO technologies. The other thing you need to do is actually choose another passphrase for your password manager. And a password manager allows you to manage the rest of your credentials. So you choose a master password to unlock the password manager, and the password manager takes care of the rest. So what are the common password managers out there? Well, there's 1Password, that's one of my favorites, LastPass, and KeePass. And you can actually configure these password managers to randomly create, for example, 15-character passwords. Like if you're using sites that don't allow you to use anything over 15 characters, you could actually configure your password manager to do that for you. So let me show you how easy it is for a threat adversary to crack your passwords. Now, ordinarily, what an attacker is going to do is they're going to break into your company, and they're going to get to Active Directory, and they're going to extract all the password hashes for your users, and then they're going to crack those offline. Okay, so let me actually show you how that works. So I'm going over here to this website that allows me to generate random words, right? So we're going to pick words that are 14 characters long. Right here, I put in 14. I'm going to hit generate. So all this is doing is generating a word list, because I just want to pick a random word. So I'll just, I don't know, pick something long. Quadrilateral, right? So I'm going to pick that word, and I'm going to plug this into a different website, a different web form that allows me to convert this word to leet speak, right? So instead of, an I, it might be a 1, or instead of an O, it might be a 0. I'll show you what happens when we do so. So let's pick a random number. Well, what's the date today? Let me go over to the date. It's September 12th. So I'm going to go ahead and stick in a 12. And then let's pick 2 symbols, 2 random symbols. We could use a star, we could use a $sign. So then what we're going to do is take this string here, this word, 2 numbers, and 2 symbols, and we're going to convert it to leet speak. And here we go. And if you take a look here, right here, this actually looks quite complex. You would think that an attacker could crack that password if that is the password you're using to log into your computer. But what the truth of the matter is, an attacker can do so quite easily. So let me actually show you how that works. So I'm going to copy the password. I'm going to go over to my password cracker, and I'm using 8 GTX GPUs. So I get billions of password tries a second with Windows NTLM hashes. That's in the billions, not the millions, the billions. So what I'm going to do is run my program. I'm going to put in the leet speak credential. That looks like complete gibberish. I'm going to hit enter. And then what my program does is it generates here an NTLM hash. Because Windows doesn't store your plain text password in the operating system, it stores the NTLM hash in Active Directory and in the operating system. So what I'm going to do is I'm going to hit enter to continue, And there's going to be a little bit of a pause because my cracker has to actually start up. So let me hit enter. And as you can see here, we have the 8 GeForce GTX 1080 cards. So we get an extremely fast rate of password cracking. And it started, so I'm going to hit a status, and as you can see here, I'm getting quite a bit of password tries a second. Wow, it already finished. So it literally took under a minute. We started at 03:48:22, and we ended at 03:48:53, and we're able to crack that password hash with my 8 GPU cracker. So again, how are you going to protect yourself against a threat adversary cracking your password? Stop using passwords. Start using passphrases, 25 characters or more, a sentence with spaces. So it's extremely easy for you to remember. If you want to make it a little bit more difficult, you could always misspell one of the words in the sentence. Always use multi-factor authentication wherever you possibly can. And remember, if you have a very complex password, you can't stop malware, malicious software, from intercepting your password with a keylogger. You also can't stop a sophisticated hacker from a spear phishing campaign. What you have to do is use KnowBe4's new security awareness training and simulated phishing to mitigate that type of attack. So please stay safe out there. Start using passphrases instead of passwords. Thank you so much.
Okay.
I use LastPass just to
Pardon?
a disclosure. I use LastPass. It changed my life.
Oh, okay, that's good. I think I just closed my presentation. Hold on just 1 second. But we are kind of at the end of the presentation, but
yeah. If you want to stop the share while you're getting it back, you can do that.
Yeah, I just I need to get.
If anyone has any questions, and
it's been very informative, Leela. Thank you so much.
No problem. So let's just continue. Hold on, I'm just trying to get back into my presentations. And if you have any questions so far, just let me know, but let's just continue. Yeah, for those of you who want to learn more about cybersecurity, I mean, you can actually look at Kevin Metnick's videos. He's really good, and I mean, he is a hacker, but he's a very good kind of a cybersecurity consultant nowadays, and it's really beneficial for those people who want to actually learn more, to actually follow his presentation and all that. So I'm just gonna share my screen again. Okay, and there is another video, but I'm not gonna, this is with Dr. Phil. You can actually search Dr. Phil, Kevin Metnick, and it's very funny how he's actually showing Dr. Phil how to secure his computer. So basically, I just wanna kind of go a little bit farther. So we talked about phishing. So some of the phishing, so this is, there is a website that you can actually go and see a lot of, it's called phishing.org, phishing examples. This is a great place to kind of go and look at the examples. This, probably a lot of you get this a lot if you use PayPal. I get it all the time, and it's actually look very similar to the PayPal. Before, they used to make a lot of spelling mistake, many things like that. But the best thing is what you want to do is making sure that it is actually the email address that you want to look at. And sometimes when you click, if you click on it, you see exactly it's taking you somewhere else. Just get out of it right away. Because if it was from PayPal, it would take you to paypal.com. But normally now it's taking you to maybe something like similar to paypal.com, like PayPalPy.com or something like that. So it could be like similar to that. So you want to kind of get out of it. There are a lot of examples that you can actually go through that website. Also, this one is another one. They're very kind of very tricky. But other things that maybe you might want to think about is just like this kind of a link maybe is suspicious. You know, this is not Wells Fargo, right? Wells Fargo won't have this type of a link. So you want to make sure, even though it says Wells Fargo here, you see here the reply, it says email, hit reply. So this is kind of like fishy, you know, or this link is kind of fishy, you know, it's not a Wells Fargo website that's taking you. But the best way is to go to phishing.org, phishing examples, and you see tons of great examples and up-to-date phishing emails that is being sent to a lot of organizations. With that being said, I'm just gonna finish this presentation. If you have any questions, you can email us. This is md.connect@gmail.com. Also, you can see us on social media. We have Facebook account, Twitter, LinkedIn. So any of that, you can just send us. We would appreciate if you get back to us. And as this is a FBI code, healthcare providers typically do not use the same high levels of security technology as companies in other industries, even though there are a lot of data breaches and there are a lot of money involved in the data breaches. So make sure that you need your, if you are working for a hospital, if you are working for a healthcare provider, if you are working for a doctor's office, or if you are a doctor who have an office, make sure that you actually follow the all the security standards and kind of provide trainings to your employees and all that. So if you have any questions, please let me know. Other than that, that's it for today's presentation.
Thank you so much, Leila. Does anyone have any questions? Want to place them in the chat? We can ask them as well if you don't want to unmute yourself. Getting a lot of thank yous. Thank you for the informative presentation from May. Thank you for joining us, May.
Thank you all for joining, and just let me know if you have any other questions. You can send us an email and we'll get back to you guys.
Sounds great. Thank you, Leila, for helping us to learn more about cybersecurity and just kind of like as a physician, I think getting more and more involved in technology and learning about how important it is for physicians to use it. It's also at the same time important to stay secured and learn how to protect yourself personally or the institution that you work at. So those information were very helpful, and I hope a lot of physicians in the future will get to learn more from you. If you guys have any other questions, feel free to email us after the presentation, and we'll have the recording ready for you afterward.
Thank you, guys. Enjoy the rest of your week.
Thank you.
Bye-bye.
Bye-bye.
Bye.